If you're over 50, searching things like, why is my cholesterol going up after menopause? Belly fat, I can't lose, or insulin resistant symptoms, you're not alone. And you're not doing anything wrong. Right now, women are asking why their cholesterol numbers are changing, even though they're eating the same, exercising more, and doing everything right. They're noticing stubborn belly fat, rising blood sugar, and confusing lab results all at the same time. The truth is, after 50, hormones, insulin resistance, and cholesterol are deeply connected. Today, Dr. Michael Horne from the University of Colorado Anschutz College of Nursing helps us break down the confusion and gives us simple answers.
Thank you for joining us again today.
Sure, glad to be here.
Okay, so today we are going to talk about different age groups and cholesterol and how it impacts people at different ages. And we want to start to talk about as we get older. I know that myself and other people have noticed as we get older, our cholesterol numbers start to kind of rise with that. So we want to talk about cholesterol management for people over 50, 65. How do we approach that differently?
So, and starting off from a pure guideline standpoint from the American College of Cardiology, there is no difference up to age 75. So when they did their guidelines, they had study and research through that level. And so whether you're 60, 65, 70, that doesn't change. Now, the question is, okay, I'm 76. Does that make a difference? Well, we actually do have some ongoing studies now in the population over 75 to help us know that. My bias is that we're not going to see a big difference in terms of what we should do. You know, if someone is in an end of life situation, then that's different. But if someone is a healthy 60, 70, 80-year-old person, we want to keep them healthy, right? So whether that's a statin if they need it based on their risk profile or blood pressure medicine or whatever, we need to continue to be aggressive in treating them. And they need to continue to be aggressive in lifestyle management, because it's even more important as we get older. You know, for example, for cholesterol, is that the damage from higher cholesterol is a cumulative type thing. So the longer you've had it, the more worse it is, right? And thus, as you get older, you're going to start seeing the impacts of it more than you would when you were 40, even if you had high cholesterol when you were 40, because it's been around more. It's called LDL cholesterol years, kind of like smoking pack years. So that's why it's even more important as we get older to emphasize the lifestyle habits in terms of staying active, trying to get that 150 minutes a week of exercise or more, including strength training, maintaining our diet, not eating a lot of saturated fats or refined sugars or ultra-processed foods, eating vegetables, lean proteins, certainly not smoking if you smoke. But, you know, I think the big thing really, and then a lot of older people tend to do some of the diet stuff easier because they don't really get as hungry as much. So their diet actually doesn't get bad sometimes because they don't even want to eat as much. But what does go down a lot of times is I see movement and activity. People start slowing down. And we kind of have a statement, you know, when you stop moving, you stop moving. And so that's probably one of the biggest message I could give with older populations. And I'm in that group now, I'm 63, right? So that we don't want to stop moving. We want to keep, you know, you certainly adjust. I don't ski as aggressively as I used to, right? Because if I fall,
Right.
something's going to break, right?
Yeah.
But I still ski. I don't run marathons anymore, but I still run half marathons. So, you know, you do some adjustments, but keeping active, I think and we also know that from a brain health standpoint, we're talking about heart, but from a brain health standpoint, that's critical too, to keeping, and it reduces Alzheimer's risk, et cetera.
All right. Let's talk about postmenopausal women because we're
Mhm.
really targeting a lot of women going through menopause, postmenopause. Are there considerations for that segment of the population?
Absolutely. And it is a very complex topic, let me first say.
Oh, great.
So there was a study, it's still an ongoing study, but the original results were published in 2002 called the Women's Health Initiative, WHI. And it had some very concerning results in terms of post-menopausal hormone replacement, in terms of some potential damaging things, cardiovascular risk, blood clot, breast cancer, et cetera. As we've gone through over time and done a better job analyzing that, and it had some limitations, some of those are not as much of a concern, but there are still concerns. So what do we know from a heart standpoint and cholesterol standpoint? Well, we know that post-menopause, we do have an increase in LDL typically. It's an increase in the number of particles of LDL, which are more damaging than even the total number of the total amount of cholesterol. It's measured by this thing called apolipoprotein B. So, but that measures the total number of cholesterol particles. So we know that's there. We also know those particles are a little more potentially damaging. So we do know that there's an increased risk. The other thing that happens after menopause is a lot of women, just due to the way the body shifts, will have an increase in visceral fat. That's kind of what happens sometimes. That causes more insulin resistance. And we'll talk about in a minute, insulin resistance is also a risk factor for cardiovascular disease. So we know there's some factors that are occurring after menopause. So the first question would be, why don't we just give estrogen to replace, what we've lost during menopause and fix that? Well, the studies are still somewhat mixed and ongoing, but in general, it doesn't appear that the benefit from giving estrogen and it should be estrogen and progestin combined if you still have a uterus. That's the current treatment. But either for postmenopausal women, the risk is greater than the benefit for heart protection. So the current guidelines say that the use of hormone replacement in postmenopausal women should be more for symptomatic management, sometimes for extreme bone loss, but primarily symptomatic management, not for heart protection. We do know that if you do have hormone replacement, it's better under age 60 and within the first 10 years of menopause. And there's probably greater heart benefits or less heart risk, whichever the mix of the studies come out in that case. So that's good.
So it's complicated. It's almost like there are nuances and it's within a certain time frame. Like the benefits are within a
Yes.
time frame, so you have to kind of be on it.
Right. Sooner than later. And the other thing is there's a difference in the way it's applied. So the oral hormone replacement actually will reduce LDL more, but it increases the blood clot risk more than transdermal patches for hormone replacement. So again, it's such a complex topic that you really need to discuss it with your provider for your individual situation. Because there are even some situations like history of breast cancer and other things that you shouldn't have hormone replacement. But what we do know is that premenopausal estrogen is heart protective. And again, so it's kind of that dichotomy. Well, why wouldn't you just replace it postmenopausal? But I think the challenge is there's so many other factors going on that it's not a clear answer. Now, what we can do postmenopausal, though, I mentioned that insulin resistance and due to the increase in visceral fat is work on those lifestyle issues, right? So we can reduce how much of that increase in visceral fat occurs through activity and diet, which absolutely will help. And then if you are taking hormone replacement for symptomatic management, which is, again, an improved use, you may be getting some cardiovascular benefit. You're probably certainly getting some LDL reduction. Whether or not, again, that translates, that's where the science is still kind of not clear.
Interesting. Let's talk about along the line of, the postmenopausal women. Let's talk about we're not only that we're living, even if you're younger, older, we're living in a more insulin resistant society. I think more people are getting diagnosed with prediabetes or type 2 diabetes these days. How is this impacting cholesterol?
Yeah, that's a great point. And unfortunately, yes, more people are getting diagnosed with type 2 diabetes, which causes a lot of complications, kidney disease being one, but cardiovascular disease being a big one. And what happens with prediabetes, or especially when you're diabetic at type 2, or type 1, but type 2 is the one that's growing. There's insulin resistance. And what this insulin resistance does is really two things. Increases the atherogeneity, the bad effects of the LDL cholesterol. It kind of changes their makeup. It makes more particles, and more particles are worse. And then it also changes the vasculature so that it's easier for those particles to embed in your blood vessels and cause fatty streaks and maybe clots. So it does two kind of bad things. So that's why in the last 4 to 5 years, the diabetes guidelines have changed dramatically so that they're not just trying to manage blood sugar, which obviously is important, but they're using medicines that manage blood sugar and reduce cardiovascular risk. Medicines that are called SGLT2 inhibitors, GLP-1 receptor agonists, which are also used for weight loss. But so there's been a much greater appreciation of how detrimental diabetes and insulin resistance is for cardiovascular risk.
Okay. And you talked about this earlier about menopause and how, it changes the way a woman's body processes cholesterol. Can you go more into detail on that? And then what role does that decline in estrogen play in the LDL, that bad cholesterol?
Yeah, so the estrogen has a protective effect in terms of reducing the amount of LDL total, the number of particles, which is even more important, and protecting the vasculature from some of that LDL lodging into it. There's a fairly complex set of things that happen with menopause, right? That's
Yeah.
just one of them, and that's
Yes.
not the only way that your cardiovascular risk is increased. We can't fix that. People are going to go through that stage, and just like men, actually, lower testosterone also is not healthy for heart protection. But what we can do is what we can do about it, which is if you're postmenopausal, the key thing is the same list we would normally have in terms of diet, exercise, all that. But what we found is that saturated fat is even more detrimental for postmenopausal women. So not eating too much saturated fat. Again, that's not necessarily eliminating all the red meat at all, but maybe eating smaller portions, maybe eating less frequently. Eating lean proteins like chicken, salmon are excellent. So that's a big one. Ultra processed food and ultra refined carbs and sugar. That's another huge one. And then the normal things, exercise, Mediterranean diet kind of things. But specifically for postmenopausal, the saturated fat, the ultra processed foods, and the refined sugars seem to be even more detrimental because they're adding to that insulin resistance that's already higher in that population, and the LDL that's already higher in that population. So it's even more important.
Okay. And you had already kind of mentioned in the past exercise. There's a certain kind of formula that you seem to think that can help, in addition to the diet that you're talking about,
Uh-huh.
a certain type of exercise, kind of that combination that you do see results in if women, especially in the postmenopausal menopausal range, start changing the diet and adding in the exercise. Are you seeing uh, dramatic improvements?
Absolutely. So
Really?
the general guideline, 150 minutes a week, and
Okay.
that should be a combination of what we think of as aerobic activity like walking, running, ski, whatever, and some strength training because
Yes.
you need both. And there absolutely is a positive change on that in terms of number one, it significantly increases your HDL cholesterol, which is the good cholesterol, right? The LDL is the bad, the HDL is the good. So the HDL helps take away the LDL sometimes. So exercise is the most important way to increase HDL. So that's a good thing. The other thing it does is that just across all of the cardiovascular risk factors, exercise helps. So it's not just cholesterol we're managing here. It also typically helps, again, prevent, we mentioned dementia risk, makes you feel better, makes you able to do more, makes you more active. So there's very little negative. As I noted, you got to be sensible. If you're just starting a program, you want to start it slow and go gradually. Do it with your healthcare provider if you make sure they're okay with you doing it. You don't have any risk for it. But then continue and continue to build it. And again, the main thing, continue it. I have she's passed away now, but my mother-in-law was 102 when she passed away. And she was on one very tiny blood pressure medicine. That's all. And that's all she was on. Literally, she broke her hip twice, and like, a couple of weeks after she could get out there and outwalk me, and I'm convinced that's why she lived that long.
Well, I'm hearing the benefits too. I think a lot of people get scared, like, okay, I have to go exercise. I have to do this. I have to go to the gym. And for me, it was a matter of, I was able to lower my cholesterol by, we had mentioned at a different point, cutting out the white sugar, the white
Mhm.
processed carbs, adding more protein, more fruits and vegetable. I'm not 100% there yet. There's a lot of things I need to do with my diet as far as like I've learning from you, really cutting back on the red meats, the saturated fats, adding more of the fish. But that combined with just picking up some hand weights and doing, I mean, I'm posting some simple exercises online and then walking. I think there's this fear like, okay, I got to go running. And so that makes people stop. But I think just simple steps. Okay, I'll pick up some hand weights, look on YouTube, find some videos, and I'm going to go for a 15, 20-minute walk.
Yeah. Walking is one of the best things I think as we get older. I
Okay.
mean, if you're a runner, great, keep running.
Yeah.
Walking is wonderful because it is activity and it's a little bit safer activity. If you're a runner and you still got good balance, great. But if you're not, obviously as you get older, stuff that you're moving faster sometimes can be a little more dangerous in terms of falls. Walking typically is not, right? And it helps continue to build balance. And it's a great activity. Plus, it's fun. You get out wherever you do it, right? If it's a nice day, you're outside. If you go to the mall, you see people around there, whatever you do. But it also gets people out. And sometimes as we get older, especially if maybe one spouse is lost and the person's by themselves, one of the worst things mentally and physically is unfortunately sitting in your house all day, right? And so that's another reason to do it.
Okay. Well, these great advice. Anything else that you think that our listeners would like to hear about improving cholesterol, things that they don't know about, simple steps they could do to change their lifestyle?
Yeah, I think I talked about a lot of those. I think I'd end with just the importance of keeping moving. And the other thing being, if you do need a statin, if your provider suggests you should take one, you should take it. There really are no natural alternatives. There's something called red rice yeast, but it's not consistent. So if you need it, I know people like to take medicines, but if you need it, you should take it. But continue to do the lifestyle things. And the biggest one, I think, honestly, being as we get older, especially keeping moving.
Okay. Great advice. Thank you so much, Dr. Michael Horne. We appreciate
Thanks.
it.
I enjoyed being here. Thank you.
Thank you.
Thank you for listening and being part of our Women's Healthy Aging series. If today's conversation helped you, be sure to follow and share the podcast. And stay tuned for more expert insights, practical guidance, and empowering conversations to support your health journey at every age.